Everything has started. Here we go. All the cameras are going off because I've just started the transcription. So please do put them all back on again. And hello and welcome. This is our June AIESEP Connect. If you've not been to an AIESEP Connect before, I'm Professor Christy Howells. I'm based down at Canterbury Christchurch University, and I'm your AIESEP board representative that looks after the AIESEP Connect. Our AIESEP Connect is our global outreach program. It is a space and a place where we engage in hot topics that are linked to our core mission. It's our monthly engagement of our 1 hour. And what we do is we try to foster an inclusive, equitable, and diverse environment in lines with our vision and our mission. We try and create a really safe and supportive place where everybody can share their research, share their visions, be respected, be heard, be valued, and encourage meaningful discussion. So as we go, if you have any questions for our speakers, please do put them in the chat, and we will have time to have conversations at the end. I just need to remind everyone that the views and opinions expressed by the speakers, panelists, and participants are of their own and not necessarily representative of policies of AIESEP. We thank Risto for enabling this to be on Playing with Research in Health and Physical Education, the podcast that you can find on Spotify, and this will also be recorded for our AIESEP YouTube channel. So what I'm going to do is I'm going to throw over to our amazing speakers, as we have lots of them today. What we're going to be focusing on in particular is the global physical literacy framework. So heading straight over to Johannes, please.
Yeah, thank you very much, Christy, for the organization and for the opportunity to present this framework and different applications across the world. And the topic of today is physical literacy. I'm starting with a presentation on physical literacy across the world from a global framework to action. I'm starting by describing more actually what physical literacy is. And recently we have worked out a sort of a analogy that we want to use for physical literacy. We can say that it's a sort of a backpack for a lifetime. And with a backpack for a lifetime, we do not imply that it's heavyweight, but rather it's that a sort of a companion for us that we develop, that we carry, and that empowers us to be active for life. So more specifically, physical literacy integrates something like motivation, confidence, physical competence, knowledge and understanding to value and take responsibility for engagement in physical activities for life. We can also briefly describe it as our relationship with physical activity. Yeah, it develops across the lifespan, so there might be ups and downs of our relationship with physical activity, but there is a sort of a holistic idea of all the learning domains of physical activity that we need. So our ambition as educators, as coaches, should be that we try to equip everyone, everywhere, all people with this relationship for life. And physical literacy, including their domains, is strongly featured by different organizations such as WHO, as here by UNESCO, such as the Quality Physical Education Guidelines for Policymakers. So it's strongly on the global agenda over the last years and decades, we can say. Nevertheless, we have identified some challenges 2 years ago. There are still different understandings of physical literacy worldwide, which might sometimes create a sort of confusion. We have different actor networks of physical literacy, and I've visualized this here with this figure where, for example, a Canadian research group or an Australian research group has found different networks which tend to remain in their own silo, not strongly communicate with the others, and they try to defend their own understanding of physical literacy. So we can say that there's also a lack of cooperation. And then most importantly, while the field is very good in looking back where physical literacy comes from Margaret Whitehead and the conceptual philosophical origins, there is or there was 2 years ago, a lack of guidance for the future of the entire physical literacy field. So therefore, our study group, and with we, I mean that it was primarily an initiative by Deakin University in Australia. We want to define the goals and principles, as well as actions and pathways that move physical literacy forward across the world. So we wanted to ask, on the one hand, what is necessary to move the field forward, but also how this can be done. And we wanted to bring all the main actors of physical literacy together. So on the one hand, we've defined geographical representatives. So we've defined regions across the world where on the one hand, physical literacy has already undergone strong discussions, but we also wanted to achieve a global coverage. So do not miss important areas and regions of physical literacy. We've also identified representative of special thematic interest because, of course, there was already literature discussing what is actually missing in the field. For example, discussions on older adults or indigenous backgrounds, individuals with disabilities, practice translation, community design, but also something like climate change. And as the third representation group, we wanted to include society representatives because we will also already think about the dissemination of the framework, and the societies who have an interest in the area of physical literacy, physical activity and health. We let them co-participate in the process in order to disseminate the framework. And here, indeed, AIESEP was one of the partners. We included all the different representatives and developed a so-called group Delphi method, which aimed to foster exchange through also face-to-face discussions online. I do not want to further comment on the methodological background of this framework at this point, but here is already the framework on this slide. The framework had the overall vision that we wanted to better harness the potential of physical literacy for quality physical activity experiences for everyone worldwide. You know, the WHO is only or has strong efforts in increasing the quantity, the physical activity behavior, but physical literacy is really about the quality of physical activity experiences. On the right side, you can see the framework, which is available on the website, and it has the motto, "Let physical literacy flourish," because there are strong philosophical discussions about human flourishing as well, and we want to use this kind of picture for our framework. The group Delphi process resulted in a total of 5 action areas with recommendations on how to move the field of physical literacy forward. And this is advocacy, practice, education, assessment, and research. Since this is an AIESEP forum, I want to start with the education action area. For the first thing, we could agree a little bit worldwide on some educational principles that we should consider when we want to align our educational practices with physical literacy. This is holistic learning and development. The student should be in the center and not norms and standards. We have to ensure support and inclusion. We have to ensure lifelong learning. We have to provide students with voice and choice, enabling work across different curriculum areas. But next to those educational principles, we request that pedagogical resources should be developed and disseminated in all countries. The physical education curricula should align with the principles of physical literacy. And we should not only equip educators with the knowledge, skills, and resources, but also we should empower school leaders and staff to further share this message of education, of physical literacy. I've also deliberately thought about what could be the potential transformation potential in the educational area. And I would hypothesize that physical education or education is the most important societal sector for the learning of movement. And here physical literacy could serve as the overall narrative for learning processes. Physical literacy also transports the message that we should go away from activity delivery and only physical orientations to really meaningful learning for everyone. And physical literacy could provide a shared educational language for teachers, coaches, and community facilitators. And of course, teacher education and professional learning is the potential lever for system change. I want to now scan through the other action areas. There are, for example, 6 key principles for practice. For example, that we have programs that can be accessed by all. We should better identify and develop best practice programs, work in multidisciplinary teams, empower professionals, volunteers, and family members. But we need solid and sustained investment for the effective transfer into practice. Of course, physical literacy does not operate in a small room, but we have to create environments and equipments that reflect the principles of physical literacy. We have the advocacy section, where we also have to develop national understandings and dissemination strategies. Physical literacy can benefit from the inclusion in national physical activity guidelines. We have the assessment and research space. I will then afterwards hand over to Kasper, who will tell more about assessment. And also research has a quite important position in ensuring the transfer into practice, acting as a companion for the delivery, because as we all know, physical literacy can be quite complex at some points. Just to sum it up, now the Global Physical Literacy Action Framework is available in a total of 14 different languages, because language is still the most significant barrier against the further translation worldwide. Physical literacy can and should flourish across different sectors such as education, sport, health, community, and leisure time. And the different presentations that will follow up will zoom into the different areas. And I'm already surpassing the time a little bit. I want to now hand over to Kasper, who is more specifically talking about assessment.
See it now? Okay. Hello, everyone, and thank you for the opportunity to present today. My name is Kasper Salin, and I'm working in the University of Jyväskylä. This presentation discusses assessment in physical literacy and some of the tensions connected to assessing holistic and highly individual concept. Physical literacy has gained increasing global attention in physical education, health policy, and research. Partly, this growth reflects criticism toward traditional physical education approaches, focused mainly on fitness and performance outcomes. At the same time, physical literacy emphasizes lifelong participation and meaningful fitness, meaningful movement experiences. The recent global literacy framework reflects attempts to create a shared international direction for physical literacy. But this also raises an important question: can a holistic concept meaningfully be assessed? One reason assessment becomes difficult is the nature of physical literacy itself. Physical literacy is generally understood as a holistic and multi-dimensional, including physical, cognitive, affective, behavioral, and social dimensions. Importantly, these dimensions are interconnected rather than separate. This is also to philosophical ideas such as monism, existentialism, and phenomenology. So, physical literacy is not simply about physical competence, but also about how people experience and value movement in their lives. This slide summarizes the central tension. Assessment usually relies on standardization, fixed criteria, and measurable outcomes. But physical literacy is often described as individual, dynamic, and experiential. So there might be a mismatch between the concept and the logic of assessment itself. Assessment may provide useful information but it may also simplify holistic human experience. For example, if we reduce physical literacy in the numerical score, we may lose important aspects such as personal meaning, confidence, social experiences, and motivation. Two individuals may receive similar scores while experiencing movement very differently. At this point, I would like to briefly open the question more broadly. Should physical literacy actually be assessed at all? What might be gained through assessment? But also, what might be lost? Possibly individuality, lived experience, or the holistic philosophy itself. If physical literacy is assessed, assessment should align with the philosophy of the concept itself. Assessment should support development, reflect the whole person, and to follow individual journeys over time. I often think physical literacy like Lego bricks. People may use similar pieces, but everyone builds something unique based on their experiences and environments. So the final results may be very different. This is why comparison between individuals becomes difficult. Physical literacy develops through different experiences, environments, opportunities, and personal histories. So perhaps assessment should focus less on comparison and more on the individual development. Since around 2014, multiple assessment tools have been developed. Importantly, tools differ greatly in complexity, recorded research, and training. Some use questionnaires, others observation or practical tool tasks. The physical domain is usually included, while other domains vary more considerably. With different assessment tools, several challenges emerge in practice. Conceptually, physical literacy is complex and interpreted differently across contexts. Practically, teachers may lack training, and curriculum may not explicitly support physical literacy assessment. There are also ethical concerns, including comparison between students and visibility of performance. So challenge is not only technical, but also pedagogical and philosophical. Another important issue is balancing between feasibility and scientific quality. In schools or practical settings, assessment needs to be realized in terms of time, resources, and complexity. At the same time, many existing tools still have limited validity evidence. Can questionnaires capture lived experience adequately? Or should physical literacy include objective observations and movement tasks? And ultimately, can holistic human experience ever be fully captured through standardized assessments? Looking forward, technology will likely play a large role through IO support systems, applications, and wearable devices. There is also a risk that future technologies make assessment more efficient, but also more narrow. Assessment may also expand into healthcare and adult populations. At the same time, better teacher education, stronger research evidence, and international collaboration remains important. To conclude, physical literacy is generally understood as holistic, individual, and lifelong. Assessment may provide support and guidance, but it may also oversimplify something deeply personal and continuously evolving. So perhaps the key question is not simply how to assess physical literacy, but whether assessment aligns with its philosophy. I'm sorry that I didn't provide answer to my topic question. However, I hope the presentation gives you something to think further about physical literacy assessment. Thank you. Here you can see some references to some physical literacy tools that are in use at the moment. Thank you.
Is it now my turn, Christine? All right, let me put the slides up. Just give me a sign if you can see my slides in presentation mode. Yeah, all right, perfect. Okay, so my name is Emiliano Mazzoli, and I'll be talking a little bit about physical literacy and disability. This is a quite broad topic, and there's a lot to say about disability. So I'll talk mostly about broad, bigger ideas and try to connect it to the GLOPL as well. And then there will be hopefully some time for discussions as well. So first of all, I'm based in Australia, and it is tradition in my country to acknowledge country, and I want to acknowledge the traditional custodians of the ancient lands, skies, and waterways, of all the lands where you might be, and you might want to think about the traditional owners of your lands. I live and work on the lands of the Wurundjeri people of the Kulin Nation, and I would like to thank them for allowing me to be on their lands. This is an important practice. There's definitely more to do in terms of truth telling and apart from acknowledgement. I want to also welcome any First Nations people who might be with us today and thank them for their contribution to learning. So if physical literacy is about confidence, competence, and motivation to be active, what happens when movement is different or where there are multiple barriers to physical activity? I want to start with questions that may be a bit more provocative, but in terms of disability and inclusion, physical literacy is quite contentious, and I explain why. So now, how is physical activity or how is disability generally understood? There are several models. Two very common models are the medical model and the social model. So the medical model is saying that the individual is somewhat broken or malfunctioning and it needs to be fixed, and there's something wrong with the person, with the individual. The social model, on the other hand, it says that the individual is fine, there's nothing wrong with the individual, but there are barriers to participation and the impact that individual because of their impairment. And if those barriers are removed, then participation is allowed. So I much prefer the social model of disability because I really do believe that disability is not an impairment or condition, but it's rather something that emerges when there is an interaction between the impairment and social attitudinal environmental barriers that are all around us. And so everybody can experience disability to certain degrees. And then I want to talk a little bit about the elephant in the room, which is ableism, which is essentially the idea that able bodies are superior to those with impairment or those who experience disability. And this is problematic in physical activity environments like gyms or in competition where people need to win. So even thinking about the motivation to be active, if somebody wants to do it for fun, there's still a level of competency, and we tend to price higher competence and tell lower competence. So I want to remind everybody that we are all under the bell curve. Everybody is under a normal curve, but in general, we tend to value more elite achievement or normative peak, which is on the right tail of a normal curve, rather than performance or people that may fall more within the left side of the normal curve, which is alternative and diverse capacities often fall there. Still, recommendations for physical activity apply also to people with disability. There are multiple rights for persons with disability, acknowledged by the Convention of Rights of Persons with Disability. But we are not there yet. There are lots of barriers and facilitators to physical activity, mostly barriers. I'm not expecting you to be able to read the slide, which includes a long list of barriers that Nora Shields was able to systematically observe. This is broadly talking about barriers to physical activity in children with disability. But just to give some examples, at the personal level, there might be lack of skills or fear of judgment. At the social level, things like parental concerns or negative attitudes from society, or also at the environmental level, transport, how to get to a gym, or policy level costs. Facilitators, there are some, but definitely the list is definitely shorter. And this is also kind of somewhat matching what a publication on the Lancet talking about participation of people living with disability presented. Just glancing on this, but I really want to focus a little bit more about this work from Kyle Push-Karenko, who is amazing, and invite you to read it. And this is about physical literacy and inclusion, a scoping review of the physical literacy physical literacy literature inclusive of individuals experiencing disability. And my main takeaways from this work is that physical literacy is assumed to be an inclusive concept, but, and there's a big but, is that there are significant gaps in understanding and implementing the concept of physical literacy for people with disability. And then there's a need for more inclusive practices that can enhance meaningful physical activity participation. And also we need to really abandon this idea of deficit-oriented perspective around disability, which is the medical model, and focus a little bit more on strengths, individual strengths and capability. So a big step forward that we've done collectively globally is a global physical literacy framework, action framework, led by Johannes, and many of you have contributed. And how is physical literacy portrayed here for people with disability? Well, this is a very broad document. Of course, there are mentions in different parts. So, for example, in practice, we have mentioned the importance of focusing on inclusive programming for diverse abilities, and also ensuring that programs can be accessed by all and supported by good material. So considering factors like cost, language, location, equipment, and diverse needs of all potential participants. Within the action education, we also stress the importance of providing resources that could be inclusive and also assess diverse learning needs and abilities, and providing needs with strategies to differentiate and really provide inclusive environments. And there are multiple examples of how this can be done using, I will glance on these things, but universal design for learning is one way of assessing and teaching, using different ways of representing concept, engaging people, and also action and expression, which is about the how of learning, so how people can interact and how can you verify learning. So modifying these things. Universal design for learning is often conceptually understood as a buffet of options that is provided for different people. There's the inclusion spectrum that's been widely used in sport, tree model as well. You might be familiar with some of this. And then the idea of assessment, action 4, and also, and this is really about how we assess things and why we assess things. You just heard a lot about assessment, but just keeping in mind that assessment really needs to fulfill different purposes, and it needs to match the intended purpose. And it could, for some people with disability, can take the form of personal stories or exploring really the unique relationship that an individual has with movement, rather than really quantifying performance or having other indicators in mind. I was part of the development of this tool, which is a pictorial tool to assess physical literacy in children. It's called PLC Quest. It is a pictorial tool that uses a bunny to depict different ideas and elements around physical literacy. For example, you have within the physical domain that could be moving with equipment is one of the elements. And children pick one option, which one is more like them. Some children are pretty good at skateboarding, some children are not so good at skateboarding, and then they get to pick whether it's a bit like them or a lot like them. And then this is an example from the psychological domain, self-regulation. Again, you can see some children might be upset if they miss the target, others are not upset if they miss the target. And some of these ideas are inclusive per se, but others might not be. And we also have tried to include a representation of diverse abilities, in this case a physical disability, there playing with mates. Probably running out of time, so I'll quickly also talk about research, which is largely focused on populations, general population, and underserved populations, including those with disability, are not often considered, except from exceptions that are really looking at the specific population. So, but in general, the idea of physical literacy hasn't really been explored for this population. So, some concluding thoughts. Global action framework is great. It's a meaningful step forward, but there's a lot more to be done in relation to disability. So inclusion should be something in mind from the start, and pedagogical approaches should accommodate for different bodies and ways of moving. And meaningful movement may mean different things to different people. So keeping in mind that movement can take multiple forms. So it's important to keep this inclusive mindset in mind. Thanks for listening. I'll probably keep the presentations flowing.
João and Dora, I think you're next.
Hi everyone, we are João Martins and Dora Carolo from the Faculty of Human Kinetics, University of Lisbon, Portugal. I'm also a proud member of AIESEP. Before introducing our presentation, I would like to briefly acknowledge the collective journey that many of us shared in advancing physical literacy over the last decade. Across research, education, policy, and practice, we have built knowledge and capacity through national and international collaborations such as PHILIT, Physical Literacy for Life, Europe Lit, and more recently, the development of the Global Physical Literacy Framework led by Johannes. For those interested in learning more about this collective journey and the specific advances made in Portugal, we warmly invite you to explore our chapter in the new Handbook of Physical Literacy edited by Lisdard and Myers. One particularly exciting milestone is that after a decade of collaborative work, physical literacy is now being proposed for inclusion in the Portuguese physical education curriculum. This progress has only been possible through the contributions of many colleagues and students Today, Dora, one of our PhD students, is completing her doctoral studies under the supervision of Catarina Queiroz, Dean Dudley, and myself. She represents the next generation of scholars, bringing fresh perspectives, passion, and a strong sense of purpose as she expands physical literacy into aquatic environments with the Aquaphilite Intervention Program. Dora, the floor is yours. The sound, Dora, please.
I'm sorry. Thank you, João, for the introduction. Good morning to all from Portugal. I'm Dora Carolo. I'm presenting about my aquatic physical literacy, part of my PhD studies. I would like to start this presentation with one central question. How can we encourage people to be more physically active in blue spaces while also helping them to stay safe in, on, and around water? This question has been central to me as I started working as a lifeguard at the age of 18. Blue spaces can support health, well-being, social connection, environmental awareness, and enjoyment. But they are also places where risk, inequality, and exclusion are real. So the challenge is not only to teach people how to swim, and it's not only to tell people to avoid risk. The challenge is broader. To help people develop a positive, informed, competent, responsible, and sustainable relationship with blue spaces. This is where physical literacy becomes important. Physical literacy asks us to look at the whole person: motivation, confidence, physical competence, knowledge, understanding, values, social relationships, and environmental the environment where movement happens. In the aquatic context, this holistic view is essential. Traditional aquatic education and drowning prevention have often focused on swimming technique, survival skills, or a safety message. These are important, but they are not enough. A person may swim well in a pool and still make unsafe decisions on a beach or a river. A person may know a safety rule, but still lack the judgment to act in the dynamic environment as a river or a beach. For this reason, we have been exploring the conceptualization of aquatic physical literacy. It does not replace water competence. It was a concept central to drowning prevention and aquatic education for many years. Instead, it expands it and clarifies it as well. It includes aquatic competence, but also knowledge, understanding, attitudes, values, social behaviors, and a lifelong learning perspective. In simple terms, in our perspective, aquatic physical literacy is the development of attitudes, values, social behaviors, aquatic physical competence, knowledge, and understanding required to value, take responsibility, and actively engage in water safety behaviors and blue physical activities throughout life. These individual capabilities emerge from the interaction of the individual's holistic learning through blue physical activity and sports with the individual maturation levels and the person's physical, social, and cultural environment as well. This also changes somehow how we understand drowning prevention. It is not only about knowing how to swim, again, to avoid death or injury. It is also about developing the capacity to perceive risk, make decisions, take care for oneself and for others as well. So there is a social component here, and adapt to different aquatic environments. One example of a practical implication of our conceptual work is the development of Aquaphilite. The Aquaphilite project was developed from this need for a paradigm shift. Its purpose is to apply physical literacy and ecological dynamics principles to blue physical activity behaviors, drowning prevention, and health promotion in blue spaces. This project is organized around 3 interconnected targets. One about the healthy citizenship behavior and active lifestyles. A second around aquatic safety and accident prevention. And the third one on the health of blue spaces. This ecological dynamics perspective is useful on a teaching learning process level. Aquatic environments are dynamic, so waves, currents, temperature, wind, depth, equipment, peers, and emotions all of these shape what people perceive and do in the water. So learning should therefore include exploration, adaptation, and decision making. Be enough challenge to learn, but having enough support to remain safe. In practical terms, Aquafility is a school-based pilot intervention study in this phase of development. Is developed through a co-design perspective with schools and sport organizations as partners, as well educational administrative bodies. It combines teacher and sport coach training mentoring and blue physical activity learning experience grounded in physical literacy and ecological dynamics. Alongside intervention development, we are now validating instruments to assess participant development on these 3 pillars that I previously presented. And the project also includes credited training sessions and courses for PE teachers and school sport coaches. And sport coaches, I mean, supporting professional development and future implementation. I would now like to connect this work with the Global Physical Literacy Action Framework, which is the focus of this webinar. I think this framework will help us to move from the conceptual perspective to a more coordinated action, also regarding aquatic physical literacy and specifically aquafility. For advocacy, aquatic physical literacy can position blue physical activity within the broader agendas, including health, education, sport, sustainability, public health regarding drowning prevention and community development. It gives us a shared language across sectors, which is needed to advance on policy making and research. For practice, it reminds us that aquatic programs should provide quality experiences, not only technical instruction. Coaches and professors need to design inclusive, meaningful, and adaptive learning environments. Therefore, quality and research-informed CPD initiatives are needed at this point to support these changes in practice. For education, aquatic education should be included in curricula, teacher education, and school sport and community programs. In Portugal, we are now advancing in this area, and we are really happy with the type of work we are doing now. We hope we will be able to implement it fully in the next years. For assessment, it challenges us to measure what matters, aquatic competence, but also confidence, motivation, knowledge, and decision making. And for research, it invites strong evidence. We need to understand what works, for whom, in which contexts, and why. My main reflection today is that physical literacy can act as a bridge. It connects blue physical activity promotion with drowning prevention and broader sectors. It connects aquatic education with environmental responsibility, and it connects individual capability with other social and ecological conditions. But there is also an important caution. If we use physical literacy only as a label, nothing changes. The concept has value only if it transforms pedagogy, assessment, policy making, and practice. Therefore, the implication is not simply to add the word physical literacy to existing aquatic programs. We have to redesign it. the experiences that people become more capable, confident, knowledgeable, responsible, and connected to blue spaces. Thank you for having us.
Thank you, Dora. Perfectly timed. Heading to Jean-Pierre and Alex.
Thanks, Christy. We are sharing the slides now. But as a beginning, I would like to thank the AIESEP. And as a board member, I'm really delighted to see that the AIESEP is supporting the development of the Global Physicality Framework. And also, I would like to say that as the representative of the University of Liège, we're also delighted to be there from the very beginning of this project. And today with Pierre-Weerts, who is a PhD student here at Liège with me, we will speak about another domain of development of physical literacy. We could be interested to go further in the future and see how it will bring something improvement, something better for the people and the participants in this specific area. So thank you, Jean-Pierre. I'll leave you the voice.
Thank you, Professor Mouton. Very pleased to be presenting my work today with you. And first, we're going to talk a little bit about the question why physical literacy in health promotion. As we already discussed, there's an increasing prevalence of chronic disease worldwide. And while adapted physical activity programs are effective, maintaining participation over time remains quite a challenge. Many programs often focuses on physical outcomes such as strength, such as endurance, such as flexibility. And our idea in this intervention was to use physical literacy as a guiding framework to support long-term engagement after the intervention. So for those reasons, we developed a physical literacy-based intervention. We had association with two projects here in Belgium. First one was Mouvement pour ma santé, literally moving for my health, and the second one was called Bouger Plus, so move more. And as one is very local, the other one, En Mouvement pour ma santé, it's a national project available over 30 different cities. So very different context that those two programs are. For both of those programs, participants were first referred and completed a physical literacy assessment. They then participated in a group-based adapted physical activity session over a 12-week period with a physical literacy follow-up assessment. One of the program also had, because of funding, an individual follow-up over phone call or on video. And this protocol was published in 2024. One of the main challenge of our intervention was to translate the physical literacy framework into a practical intervention. We designed this program around a 6 domain of physical literacy, and we follow the work of Petrusevsky in 2021 about framing physical literacy for aging adults. As you can see, the physical competence was developed in every single session, while the remaining 5 domains were prioritized twice during the intervention cycle. For instance, for the domain of engagement in physical activity, we provided with monitoring tools for the participants. For the domain of knowledge and understanding, we discussed about the local physical and social physical activity opportunities available in the area. For the motivation and confidence domain, the participants were asked to take responsibilities during the session, and so on. As I said, we had a collaboration with 2 different contexts here in Belgium, and they were quite different. For instance, one was free of charge for the participants with phone calls follow-up, while the other one was low-cost membership, and there was no follow-up. Some session was taking place once a week, while the other program was taking place up to twice a week. Also, the session duration was different, and the group size was also ranging from 15 participants for the project En Mouvement pour ma Santé, and up to 20, 30, sometimes 40 participants, depending on the week, for the program Bouger Plus. We collected quite a big amount of data over the years, and when we combine both programs results in this table, participants exposed to the physical literacy intervention, so on the right side of the table, show greater improvement across different physical literacy dimension compared to the control group. For instance, the physical competence was statistically improved. The engagement and physical activity domain was also significantly improved, and the meaningful and purposeful activities domain show a greater impact there as well. At the bottom of the table, you have the total physical literacy score, and it was also significantly improved overall. I want to just stop for a second over the motivation and confidence domain. As you can see, there is a trend there for a significant improvement, and we're going to talk about it also in the next slide. When we now split the results between the project En Mouvement pour ma Santé and the project Bouger Plus, if we focus on the project En Mouvement pour ma Santé, we see a significant improvement in the motivation and confidence domain. Potentially that could be linked to the individual follow-up there over phone call and video call, providing motivational support, providing goals, providing feedback of the assessment of physical literacy. We also see, when we group the 2 programs together, a significant improvement in terms of balance and flexibility for participants that were exposed to the physical literacy intervention. Interestingly, those improvements in perceived physical competence were accompanied by improvement in objective physical performance, which is consistent with previous physical literacy research. To finish up with the take-home messages, physical literacy offers a practical and holistic framework for designing community-based adapted physical activity programs. And this framework was successfully implemented across 2 different settings and was associated with improvements in several physical literacy dimensions. The future directions here for our work, we aim to evaluate the long-term effect of this intervention. We also want to expand our implementation with a collaboration with colleagues from Brazil over a cross-cultural implementation and evaluation of physical literacy-based intervention over there. And also, we want to keep exploring the role of physical literacy now in promoting an active lifestyle and healthy aging within residential care settings. I thank you for your attention.
Fabulous. Thank you so much, everybody, for your wonderful presentations today. We have 5.5 minutes for questions and thoughts. So if anybody has them, then please raise their hands or pop them in the chat if you don't feel comfortable putting your hands up. I'll start us off while everybody else is thinking about a question. Jean-Pierre, I have a question for you. You talk about physical literacy assessments that you did in your project, yet Kasper questioned whether or not we should even be assessing physical literacy. So the question is, what did you assess? Can you tell us more or give us examples?
Yes, we were with Professor Mouton. We were very focusing, obviously, on that presentation, and he talked about objective and subjective. What do you say that? Objective assessment, and we actually did both here because the subjective assessment was through a 12 items questionnaire assessing the five of the 6 domains that we talked about, and the remaining domain, the physical domain, was assessed through an objective assessment because we did 4 different tests. We tested the flexibility, the balance, the strength, and the endurance of the participants. We wanted this assessment to last about 30 minutes to really take a small part of the first and the last session of the intervention. So the way we structured this assessment was that participants did 15 minutes of the questionnaire and then 15 minutes of the physical test. If the group was about 10 to 12 strong, we divided the group in 2, and then so like in that way everybody was busy either answering the questionnaire or doing the physical test, and then we would switch the 2.
And to complete Christy really fast, I think we saw those assessments as a checkpoint in the journey of physical literacy. So the thing is that we don't want to make something transversal, but something that we can check, with the backpack. We check what's in the backpack at that point, and then we go a bit further and further, and then accompany the people in the journey. And we don't want to compare it to the others, but to see if there is some improvement, is some competency. So we see it more like that in the philosophy, at least. Yeah.
Fabulous. Thank you so much. Dora and Johannes both talked about responsibility in terms of environmental responsibility of our blue areas, or knowledge and understanding and being responsible to be physically active. How do you promote both of that? So a double question to Dora: how do you promote the environmental responsibility from a blue point of view? And Johannes, how do you do responsibility to be physical activity as part of our backpack? So I'm sending that out to both of you, please.
Yes, Jean, can I answer it? Yeah, it's a good question. From an environmental protection point of view, we already know that we only take care we only take care of what we love. So the goal is to learn how to love the environment, the blue spaces, and the biodiversity while being physically active. And we know from research that when we are physically active and we participate with others, with role models in blue spaces and other outdoor and nature physical activities, we are able to build this commitment to blue spaces protection and green spaces protection. And this is the goal, to build this care through physical activity in natural spaces and specifically blue spaces.
Christy, I can respond to you as well. And when we're talking about this responsibility aspect, I want to share my perspective on how we do that. Because when I try to foster physical literacy with this responsibility aspect, then I would actually approach that by taking the individual as the individual is. And this does not mean that I or the sports system or anything implies actually what physical activity or what this meaningfulness is. It's about asking them. And here we can draw on methods, for example, from the area of psychology, which I would call, for example, motivational interviewing. So this actually typically starts with, what are the experiences that you have made? What is your biographical background? And I take you as a person, what you need and not what others say. So you must actually have a quite empathically centered interview at the beginning, trying to capture what are the people and how can they benefit in the context of physical activity? What are their preferences? What are maybe also, by asking them very carefully, what are maybe your own self-perceived deficits where you want to improve? And then we can sort of build up a trajectory internally to strengthen your relationship with physical activity along the different dimensions. So I think it's more not so much about a structured interview guide that we can really apply here, or and it's more about trying to get a feeling about the individual, and then afterwards, and this has of course also educational implications, not just saying what the children need, but rather, no one has ever asked actually in physical education individually, how about you? How about your relationship with physical activity? We often do not have the time for that. And this is really where sort of a transformational momentum can be created, but we do actually not have the structural conditions for such a student-centered approach. Yeah, this would be my reflections regarding this responsibility building.
It's a fascinating extra area that I don't think many people would have thought about in terms of physical literacy. So to find out more about the Global Physical Literacy Action Framework, if you just literally Google it, if you are not on the YouTube channel, you are listening in the podcast, if you GLOPL Action Framework or just Google Global Physical Literacy Action Framework, the whole framework comes up for you, and also all of the translations. So thank you so much for putting them in the translations, and we can also see the scientific publications that are coming after it. I want to thank all of our presenters for sharing in our AIESEP Connect today about the Global Physical Action Framework. It's such an important area. Thank you to everybody who has attended. If you are coming to AIESEP in Taipei, there is also more in-depth GLOPL session on Friday at 8:30 a.m. So just throw ahead to all those who might be attending the AIESEP conference. Thank you, everybody, and thank you to everybody who has joined the AIESEP Connect over the past year. It is my favourite time of the month. Looking forward to seeing everybody again soon, and thank you so much for coming. Okay, so I've stopped the recording. Thank you so much.